teams, Lauren and Rebecca here with Bizrok. In this week's video, I want to talk to you about the handoff to the doctor and making sure that we're relaying the right information and being really proactive with everything that we're presenting to the patient. So Rebecca, can you kind of jump in? Because sometimes our doctors are very specific and they're like, I want Susie hygienist or Susie assistant to tell me everything about the patient before I ever walk in. Can you talk to me about that though?
I absolutely can. So I do think that it is important if we have high points that we need to speak to the doctor about, not in front of the patient, to go ahead and exit out of the operatory. Remember, always tell your patient that you're leaving and you're going to step out and that you'll be right back. Don't just sneak out. Normally what happens is they keep on with the conversation, they turn around and the team member's gone. So go ahead and let the patient know that you're going to step out and speak to the doctor. But then when the doctor walks in the operatory, it is so important to go back over the 3 questions again, read your question, and then read the patient's response. That way the patient is hearing you tell the doctor exactly what they said. It builds a lot of authority with the patient for the doctor. So once they can get that information, it also stops the patient from feeling like they need to repeat themselves again. And we've all been in a situation where it's not just the answer to the question, it's a little bit of their life story as well, and we get off on a tangent.
Yes. Now, one thing that you said that I kind of want to go back to is if you do have to step out and speak to the doctor, you should be speaking on the high points, right?
Yes,
like maybe it's an anxious or nervous patient. You can even go over their 3 questions. If the doctor just wants to know, docs, that's okay. We have a lot of doctors who are like, I don't care if you repeat it in front of the patient. I still want to know them before I walk in. And that's okay. To Rebecca's point about presenting those answers in front of the patient, guys, it's not necessarily for you to hear them again. It might not be for the doctor to hear them again if you've already shared them. It's for the patient to hear them again.
It is.
Because sometimes, I don't know what happens in the dental industry, but I swear there's this air of amnesia. It's like dental amnesia. They're like, I had a conversation with you. This is the treatment plan. And then the doctor walks in and I'm like, I didn't talk about that.
Absolutely. Happens all the time.
Right. So I'm like, that's why we do it, is so that the patient, again, guys, Rebecca, I know you're a huge fan of the power of 3.
Yes.
Right? So we ask them the question, we repeat the answer. So that's twice that they've heard it. Once from their mouth, twice from you, and then the doctor comes in. And guys, that's the 3rd time they've heard it. So when the doctor says, hey, let's talk about that treatment plan for ortho or, Invisalign, whatever it is that you guys are using, the patient's heard it now a 4th time.
Yes. It really sticks with the patient. The power of 3 for me is once that patient hears it the 3rd time, it's that final set of, yes, that is what I'm here for. That is exactly what I want to speak to the doctor about. And they don't end up going into a different subject. And we end up going from a limited exam to 2 or 3 limited exams because we're not quite ready for a full exam. And it just stops that from happening. So that way we can actually deliver to the patient what's needed for that day.
Yes. And I know in one of our recent videos, we talked about asking the patient, like, hey, have you thought about a budget if there's a large treatment plan that's needed? But guys, if you're not really comfortable, maybe the doctor's more comfortable, but somebody should be asking the patient that question in the back. And so doc, if it's you, when you walk in, you get to know the patient personally, you get to know their answers from those 3 questions. And then that bonus question of, is there a smile or a celebrity that you're like, I want their smile, right? So whenever you say, hey, is there a budget? You've already built up rapport and trust with the patient.
I agree. I absolutely agree.
Yes. So guys, role plays these, practice these as a team. And if you need help, reach out to us. Our team would love to help you and support you in any way. But as always, guys, thank you so much. And we can't wait to see you and serve you soon.